Shock and fear entered Kate's life the moment she was diagnosed with breast cancer. Soon after, she met with a surgeon who suggested a treatment plan: lumpectomy, then chemotherapy, then 6 weeks of daily radiation. Would she consent? Instead, Kate wanted a mastectomy. She said, "I want the cancer gone. Take it all. Take my arm too, if needed." In early stages of invasive breast cancer, lumpectomy is the preferred method of treatment for most women. It is less surgically invasive, and there is no significant difference in overall survival between women who undergo mastectomy versus women who undergo lumpectomy, provided these women also have radiation therapy. So was Kate being irrational by requesting the removal of her entire breast? Yes or no, she's not alone. Although lumpectomy is preferred medically, mastectomies are being performed at high rates in Canada. Overall, there is a trend toward more surgically aggressive treatment than medically necessary in breast cancer. I study health decision making because I see a gap between what is expected and what actually occurs. Decision making is a cognitive process that is fundamental to all aspects of healthcare, and yet little is known about it. Despite this, many decision-making tools exist for patients which assume that patients make decisions so-called rationally. However, in the real world, when faced with life-threatening illness, patients do not necessarily make decisions as expected. To understand this, I will be interviewing women of various ages with breast cancer. I will be exploring their preferences and their motivations across a range of decisions. I will compare and contrast those experiences to explain decision-making for younger, middle-aged, and older women in this population, because women that are younger and older have different social and emotional needs in cancer. In this way, the patient perspective, that is the perspective of your grandmothers and your mothers, your sisters, your adult daughters, their perspective will drive the development of tools and resources for cancer decision-making, and they will inform best practices for clinicians who are counseling patients early in the cancer journey. And what about Kate? She's a real woman, it's not her real name, a real woman I interviewed, who is a mother to 4 young children who lives far from a radiation facility. This work may encourage her to process her decision-making in a way that recognizes her social and emotional needs while still eliciting optimal health outcomes. Thank you.